Good afternoon. I'm Governor John Carney. I left my mask on today so that everybody realizes I'm still a Philadelphia Eagles fan, and I wear my Eagles face covering when I'm in public to protect others as much as to protect me. I'm delighted to be here on this Friday as we approach Memorial Day weekend, a significant and somber holiday weekend for all of us as we remember the veterans who made the ultimate sacrifice for our freedoms, the freedoms that we enjoy in the way of life here in our country. The actual Memorial Day is more than a week away, but we should all take some time this weekend to remember those heroes of days and years gone by. And I think about that and my own parents who grew up during the Depression, lived through World War II, the Cold War, and confronted so many things in their generation that affected our country, and have always come out on the other side better off than before. And as I think about our challenges, this COVID-19 pandemic will probably go down in history as one of those things that our generation had to confront. And I'm pleased to continue to report that Delawareans are doing their part. I'm joined today by our regular crew, Dr. Carol Route, Director of the Division of Public Health, A.J. Shaw, the Director of the Delaware Emergency Management Agency, and today the big man's here, Mike Jackson, who's the Director of our Office of Management and Budget. He has a budget report for us. But I want to start by thanking every Delawarean for pitching in over the last 11 weeks, for following the restrictions and the orders. By and large across our state, folks have done that, and as a result, we've been able to prevent the spread from overcoming our hospital systems. We've prevented the spread from taking over our whole communities and enabling us now as we go through this Memorial Day weekend to start again, continue the reopening process that began a couple weeks ago. This is a critical time for us, though. It's not a time to relax and to forget about everything that we've done over the last 11 weeks. Actually, it's a time for us to redouble our efforts to make sure that we're being safe, that we're observing guidance around social distancing, restrictions on our beaches, although the beaches will be open, restrictions of lots of various activity with respect to gatherings. We would hope that everybody has an enjoyable weekend. I apologize, I've been praying for rain, and it's raining out there today, so that I think will help us keep the crowds down, and I say that only half facetiously. We have a lot to cover, so I'm going to get right into the deck, just go over the cases and the criteria that we're using to take the steps that we're taking this weekend and the weeks ahead. We're up to 8,500 positive cases since the first confirmed case way back in March. Sadly, again, 322 total deaths. Again, most of those among the elderly and the frail. 42, almost 4,300 recoveries. And the most important indicator that we look at is the hospitalization rate at 221. It was static at a couple of days at 220, and it's way down 25% or more from its peak at 337 about a month ago. And it's really that indicator that gives us some level of confidence that we can continue to move on a gradual basis and reopen sectors of our economy. So 3,100 of the positive cases are in Newcastle County, just under 1,300 in Kent County, and of course, the hardest hit county, Sussex County, with 4,000 positive cases. And still with that, we have a hospitalization rate in Sussex County that's lower today than it's been in the last several days, and that's a really positive thing. Here's the breakout by ages. Nothing much has changed there. Still very little impact, about 5% of the cases for children and teenagers. And then our data dashboard, we've been saying for some time, that the criteria that we use to make the decisions to reopen sectors of our economy are improving conditions over 14-day intervals of time. You can see these charts. The most important one, again, is hospitalizations, the top left, and you see the red bar underneath, hospitalizations in Sussex County. There was a time about 3 weeks or a month ago, AJ, where we thought we would need some surge capacity in Sussex, and we sent some ventilators down from the northern part of our state. It didn't materialize much beyond that. We did set up a surge capacity at Nemours, DuPont Nemours Hospital, and we thank them for that. Never had to use it, and I guess they're ready to close it down a little bit. New hospitalizations by day, you can see trending down. The percentage of the persons who test positive, I've said time and time again consistently that the number of tests that we do each day differs. We don't test every day. It's mostly through the hospitals over the last 11 weeks. And as importantly, the test results that come back to us come back unevenly, some of which get backdated to the day they were actually taken, and others are input on that day. And so this is data that we really smooth out with the 5-day moving average and look for a trend, and it is trending in the right direction. Again, new positive cases continues to move downward on a those two graphs look to be the same. And so moving on to their dashboard of protective equipment, everything is, all those vessels are full. The glass is full, as we say. We had red light, yellow light, green light for a while. Now we have a full glass, a quarter, 3/4 full glass, half glass, and these, we did get and the difference here is that we did get an order of gowns in to make that a green light. So our focus now is safely opening through what we call rolling reopening. We've been taking interim steps up until today, and we will continue to take interim steps and larger steps as we approach what we're calling phase 1 on June 1st. So starting today, restaurants can apply to expand outdoor seating capacity. This is something that was recommended in our interaction, Damien DeStefano, Division of Small Business, with Restaurant Association and folks. It's a safer place to have people dining outside, and we feel like this is a good way to enable restaurants to open safely. It'll take some pressure off the indoor seating, and very positive response from town officials, from restaurants, and hopefully from the public. At 5 p.m., we will reopen more. Beaches are open now for individuals walking and exercising on the beach, but we will take down some of the other restrictions. We will still ask for folks on the beach to be socially distant, recommend but not require wearing masks, and so here's a list of those guidelines. And it's really important. We're going to be paying very close attention to the situation on the beaches this weekend to learn what works and what doesn't work, what we need to work on going forward to prevent large gatherings, to prevent people from getting too close to one another, to make sure that we have 6-foot social distancing, that folks are wearing masks as required on boardwalks leading up to the beaches. We'll have parking limitations to limit the capacity there on the beaches, and we'll look at, make sure there aren't unintended consequences there, and we've got some changes to the surf fishing rules, allowing more persons per vehicle, and provided they're from the same household, and also people have to be actually actively fishing, which we know is always a challenge. So we're going to focus a lot of our attention with respect to the beaches on public education, so everybody knows what the rules are. We'll have signs like this one at the entrances of the beaches telling folks to keep apart separately. We'll have window decals that people can display to show that they're following the rules. We've recommended beach ambassadors, and understand a number of them have been trained up to just be provide information and education on the beaches, not so much an enforcement role, but just to make sure everybody knows how to behave under this new normal. And so this is what one of the signs will look like. Practice social distancing, 6 feet apart. Wear a face covering in public places, recommended on the beach, not required. Required on the boardwalks. Keep your hands clean and sanitize, and stay home if you're sick. Don't go out if you have flu-like symptoms. As we lift restrictions for phase one, we're focused on, as I've said time and again, on expanding our testing significantly. AJ Shaw is our point person there now, working with so many partners, including the hospitals, which have done a great job to date, doing the vast majority of the hospitals in their testing sites. We'll be reaching out and have to community groups, churches, nonprofits, towns and cities to do and sponsor and partner with us in testing sites, community walking sites, walk-up sites. I've done a really incredible job in Sussex County testing all of the poultry workers. We'll be finished that at the last sites, I think, later this week. We've tested thousands and thousands in community sites in Georgetown and Seaford, in Milford, and further down at 113 as well. And so we're going to expand contact tracing. We're advertising for folks to do that. We're standing that operation with our Delaware Army and Air National Guard, and I think they've got over 100 of those guardsmen and women trained up and ready to go. Just remind everybody, now's not a time to be complacent. We don't want to undo so much of the good work and flattening that curve that's happened over the last 10 weeks. So wear your face covering. I notice as I go to the grocery store and drive around the city of Wilmington near the neighborhood in which I live, people really are following that. It doesn't matter where, what neighborhood. I see people with their face coverings. It's really good to see, and an indicator that we're all in this together and people understand that they need to think about their neighbor as much as themselves. Make sure you're social distancing. I wanted to have a couple charts. People are saying, well, why aren't we opening things? We have a lot of things that are open as of this weekend. Restaurants continue to be open for takeout and delivery. Retail has been open now for appointment. We've opened hair salons and barber shops for limited service for essential businesses. Construction and manufacturing industries were never closed in Delaware. Unlike some of the states surrounding us, we've worked out arrangements for farmers markets to reopen safely, and my understanding is they're doing a good job at that. And we've got new guidelines around UPIC produce open by appointment. We have, importantly, issued guidance for houses of worship. We never closed them down completely, although limited them quite a bit, so it would be difficult to open. I know my mother's really happy about this, that she gets to go back to church on a daily basis pretty soon, and she's excited about that. Again, as I mentioned, the restrictions to many of the restrictions to Delaware beaches and community pools will be lifted as of 5 o'clock today, and we would again encourage folks to be careful and follow the rules, and our surf fishing restrictions modified again as of later today. I'm not going to go through all of these, but in phase one, you'll see the level of capacity that's opening in so many of these business sectors. Again, I want to thank Damian DeStefano, Secretary Jeff Bullock, and their team for working with 6 sectors in our economy, represented mostly through these categories here, and enabling these businesses and sectors to open at more limited capacity, fire code, occupancy living, about 30%, most of them, some by appointment only, with face coverings for sure, and the rest, and then casinos, racetracks, parks and recs, again for phase one, targeted for June the 1st. So we've been doing a rolling reopening, not strictly a 3-phase as was laid out initially by the Centers for Disease Control and the White House Task Force with their consultation and agreement. We felt like rolling things forward and doing things gradually was a better way to do it, so that businesses, business sectors, consumers, workers, and customers could become familiar with the new normal, and we could learn from it and be smart and take appropriate cautions. And so the emphasis in the weeks ahead will be on intensified testing and community testing sites across our state, as well as contact tracing to prevent the spread as we loosen some of the stay-at-home restrictions that have been in place now for several weeks. I understand people are tired of staying at home and tired of not getting out and to the way life was, and people have made big sacrifices. I hear every day from business owners, in particular small businesses and workers, not have been able to go to work, not been able to get revenue, who have paid a big price, frankly, so that the rest of us can be safe. And going forward, we all need to thank them, go and when they're open appropriately to business and safely go back so that they can get back underway and earn revenue so that they can support themselves and their family. And so with that, I'm going to turn it over to Dr. Rattay, and then we'll go to A.J. Shaw, and then Mike Jackson will wrap it up for us. Dr. Rattay.
Great, thank you, Governor. Contact tracing is a topic that we have talked a lot about. Couple of updates. One is we are super excited and grateful to the Delaware National Guard. We now have 105 guardsmen and women who have been trained and are doing contact tracing, and this is allowing us to keep up with contact tracing at this point. But we know that the Guard is a temporary support for us, and so as we've talked about before, we're working with NORC or NORC to stand up the contact tracing system that will be in place for a good 18 months. And we're very excited that today at 5 p.m., contact tracing position applications will be available. So the best way to find the applications, you can just go to our Delaware coronavirus website and go to contact tracing, but to directly get there, you want to go to norc.org. And from there, you want to click on careers. And from there, go to job openings. And under that tab, you'll find the Delaware contact tracing application. So we're going to get that word out in a variety of different ways, but for people who are interested in learning more about contact tracing, go to our website or go to the NORC website to learn more about what this entails. And as of 5 o'clock today, you can go ahead and submit an application. Of course, I want to emphasize that we're really looking to hire Delawareans for these roles. That's really important to us. It's also really important to us that people understand more about contact tracing and what it is and what it isn't. It is really important for us to be able to limit the spread of COVID-19. As we open the economy, contact tracing is critical for us to be able to decrease the spread of COVID-19. And we know that there's people who have concerns about this, concerns that individuals may have their personal information. So we want to make sure that people know that your personal information is not going to be shared. So let's say you end up being somebody who's positive for COVID-19. The case investigator will talk to you and they'll find out who your contacts are, which means somebody that you've spent 10 minutes or more with at a distance of less than 6 feet. So you'll let them know who your contacts are. You'll give them the information about those contacts. But then they will not, the contact tracers will not be sharing any information about you as a positive case, any personal information about who you are and what was the incident in which they may have been exposed. So they're not going to be able to track this exposure to you unless you tell them that that you were a positive and that they're a contact. So we just want to make sure that everyone knows that it is very important as we roll this out that we're protecting everyone's health and everybody's personal health information. Shifting gears a little bit, I want to provide an update on long-term care testing. As of Tuesday, I mentioned that only 15% of long-term care facilities had initiated testing and had requested testing kits, testing supplies from us. And that has increased to 75%. We are very pleased to see the increased interest. Between Tuesday and Wednesday, our team called every long-term care facility and talked with them about the testing program, talked about addressing barriers with them. Additionally, we had a webinar with long-term care facilities on Wednesdays. And there were other pieces too, so federal guidance came out with a lot more clarity about the importance of testing this week. So again, we're really pleased to see an uptick of interest in long-term care testing. Which really leads me to the next update I want to provide. We are releasing today on our website a one-pager about our Sentinel surveillance program. This is an important piece for us, keeping our finger on the pulse of where there are infections in the state and how much infection we're seeing in the state. Sentinel surveillance is where we collect data, a sample of data routinely from a smaller selected group of healthcare providers who we call Sentinel providers. And this is not new for us. This is building on the influenza-like illness surveillance network, which has been in place for many, many years, where in general, our providers that are a part of that network will send us information about people with symptoms, as well as they'll send us samples, specimen on a regular basis. So what this new Sentinel surveillance system looks like is that sorry, I think I lost a slide, or I forgot. So let me keep going. The new Sentinel surveillance system, it's very important that we are working with vulnerable communities, that we have information from some of our most vulnerable communities. So we're really thrilled that all three of our federally qualified health center systems, Westside Health, DELAWARES, and Henrietta Johnson, are happily participating in this. They've been trained already. So they'll be sending us on a regular basis information about COVID-like symptoms, as well as samples, specimen from people with symptoms, but also specimen from asymptomatic people. And this is going to help us greatly to know how much infection there is and where the infection is. We'll also be working with other providers, other primary care providers throughout the state, to make sure, again, that we have a good geographic distribution and an age distribution, so that we can collect good information from throughout the state. But also importantly for our Sentinel surveillance, or our surveillance overall, and the federal government is strongly promoting the importance of long-term care surveillance for a number of reasons. One is we know that it's very important that we are monitoring infection in long-term care, but also it is representative of what is going on in the community as well. So on May 5th, we rolled out voluntary testing at long-term care facilities, but now as of June 1, mandatory testing for staff in long-term care facilities will be in place, and we'll be giving long-term care facilities 2 weeks to implement this. You know, we have learned through this experience, and one of the barriers is the cost of testing for long-term care facilities. So public health, now that we've been able to expand capacity of testing in our laboratories, we will be doing the testing in our lab as long as supplies allow for the long-term care staff testing. So with that, I believe, oh, sorry, one more thing to touch base on, which we're really excited about. We learned late last Friday that we would be receiving a $67 million grant for epidemiology and laboratory capacity, which is really so important for us to be able to do the work that we need to do right now. It includes for us hiring staff to enhance our laboratory and our surveillance and our data system, our informatics system capacity that we need. These funds will enable us to stand up the testing, to strengthen that testing and the electronic reporting systems that are needed for laboratory testing as well as for our surveillance. And this is also very important to support the case investigation and the contact tracing work that we've talked so much about here. So we're really grateful and excited to have this additional funding to support our capacity.
Thank you, Dr. Rattay. Lots of progress there in contact tracing, additional movement on our really leaning into protecting nursing homes and nursing home population. Again, going all the way back to the recommendations of the White House Task Force and the CDC, that's a requirement of moving to phase one. It's pretty obvious, the most vulnerable populations from the experience of the last 11 weeks, and therefore our efforts need to be stepped up to protect those populations. AJ, I know you're going to talk about testing, some good news there. This is going to be one of the really two pillars there to prevent the spread of the disease in our communities as we move forward.
Absolutely. So a lot of progress in the last week. So just in the last week, we've had several partner-supported events just in the Wilmington community where it might be a little bit more difficult to do the drive-through events. Probably about 300 to 400 individuals through 3 events up in Wilmington. On Wednesday evening, we did a first responder test down at Dover International Speedway. Some great partners we have down there. Did about 100 people in a few hours. Yesterday was very big in Newcastle County. We did almost 1,000 people at Middletown High School. That was a state-sponsored site. And then Christiana Care, just up the road in Glasgow, at Glasgow High School, did another site in the morning and did several hundred as well. So over the last week in these pop-up sites, we have tested over 2,000 people. And I think we have worked the wrinkles out of our drive-throughs and are now ready to go even faster down the road. So,
AJ, if I can interrupt, how's it going with the new tests? I mean, easier to do, and how's that going?
So it takes, when a person pulls up, checks in, between the time they get the kit and they get out of line, it's about 3 minutes. Yesterday with 1,000 people, there's no more than 8 cars in line at any one time. We were expecting that we might have had a rush at one time and have traffic back up on a Silver Lake Road, but it didn't. We kept everything in the parking lot. So with the speed of the test, people pre-registering, so when they come in, all they do is give the confirmation number and are given the kit, given the instructions. The efficiencies are here. We're able to do 1,000 people with about 25 staff, and I think we even probably had a few more people there than need be, so we'll now right-size that going forward. And it makes it a lot less of a logistical lift on our partners, because our thought is, so a Division of Public Health Office of EMS is going to be doing this for first responders around the state with 5 or 6 people that go around to different firehouses or police departments and do it from time to time. Newcastle County wants to get on board and really take over the testing in Newcastle County for us and do these drive-bys, so we could use our staff in other areas just to kind of give us that incremental lift in number of sites we could do. So the logistics is easy. We paid, these tests came with the ability to have people register online, show up in a half an hour increment, and then get results in 24 to 36 hours. And it speeds everything up. So the test results from Wednesday were delivered this morning.
So way better than before.
I'll think everything is getting better in this than it was before. So looking forward, Division of Public Health did a great job over the last 7 to 10 days if we could just go back one slide, yep, right here. Did a great job over the last week or so to update the testing event calendar on the website. So now we have on the de.gov/coronavirus, if you go to testing on there, it has all the testing locations in the state, whether it is the Fitch facilities where one of the hospitals might be using, where they have certain times, certain days of the week, tells you whether you need an appointment, whether you don't need an appointment or a prescription, whether you need to have symptoms or asymptomatic, and somebody could go in here, sort by Newcastle County, Kent, Sussex, see what's coming up in the next few days. So as we schedule these, everything is put on here So it links you either to the link for the state drive-throughs or the link for Bay Health or BB or Nanaco Christiana for how you could sign up for one of their testing sites. So, you know, it's not a one-size-fits-all solution when it comes to testing. A lot of partners are assisting us. We can't do it by ourselves, so we want to put everything up here so people could see what works for them. We don't want somebody to wait a few days to get tested if they have symptoms. We want them to call their healthcare provider and help find them the fastest route. But this is, you know, if you want to get tested, we're now testing asymptomatic people, and this is a good roadmap to use to find out what will work for you. Finally, what we have coming up next week. So this Sunday, we understand it's a holiday weekend, but we also know people want to get tested. We're using the Dover DMV down in Dover, as I said, on Sunday from 10 to 2. We already have about 800 people registered. We have another 200 people will register for that between 10 and 2, and we'll accommodate about 100 walk-up, I believe, or people that show up that day. Next week, we'll be, hopefully later on today, we'll be solidifying our date and time with the fairgrounds. So we're going to do something a little farther southern and western Kent County. We'll do another 1,000 people there, hopefully. First responders I talked about, that's going to be a moving list around the county as Diane Hainsworth and her team really takes that on and assists those responders. Dr. Tate talked about the long-term care facilities. And then up next is really how do we get to the employees and other essential populations. We hope they're signing up. We want them to, but we're also going to, as businesses start opening, as we go through this rolling reopening, try to work one-on-one with some employers where it makes sense to get a lot of the low-hanging fruit to increase the numbers that we're testing. So that is it, sir.
So a lot of good news there, a lot of positive developments there. I've heard Dr. Burke say on the White House calls that we need a testing breakthrough as well. In some ways, this new test that we have and the way it's administered easily and the turnaround for the test is a bit of a breakthrough. It's not new technology, but it's been very good. We've got great partners. Our hospitals continue to be the foundation of our efforts. I know as they go back to doing elective surgeries, we move forward, they're going to have to focus on other things as well. We'll have to take over some of that, and you're already working with a lot of partners on the ground and doing that and some positive things. We also are in the process of purchasing some of the machines from Labware, which is a local company, which will enable us to do the community sites more efficiently and more effectively, and that's a good development as well. For those of you who are interested in the testing data, where it's been done, who received the test, what the numbers look like, if you go on the website, de.gov/coronavirus, and then go to My Healthy Community, you can get all the data that you want on testing, who was tested, positive cases, negative cases, geographically, and with the demographics there, and I would recommend that to you. So today we also have Director Mike Jackson, the Director of the Office of Management Budget, to talk a little bit about the fiscal situation, which is so important to our state employees and our ability to deliver really important services. I think I heard some reasonably good news from DEFAC the other day. Mike, why don't you take it away?
Sure, thank you, Governor. So I'm here today to talk about two items. One is just a very quick budget update for the current year, as well as what we are planning for fiscal year 2021, as well as some of the federal stimulus funding that has come in to be able to help the state be able to cover costs that are beyond our budget that are related to the pandemic. So if we just go to the next slide, which gives us an indication of where we stand today with the state's revenue estimates. I will not progressively walk through each of the charts, but to the December revenue forecast was a time in which, as a state, we were experiencing approximately a $250 million surplus for the current year. The governor had submitted a budget in January using our December revenue estimates that was included modest growth to the operating budget of just under 4%, but record investments in our state's capital infrastructure. And really, since that time, with the evolution of the COVID-19 throughout our state, the revenue estimates over fiscal year 2020 and fiscal year 2021 have been reduced by $620 million since the time the governor had submitted the financial plan to the General Assembly. And those estimates are current as of yesterday with our Revenue Estimating Forecasting Committee. And what that means for the current fiscal year, we really have been working through a dynamic where the revenue estimates as of last month in April, with a significant level of impacts on our personal income tax, our corporate income tax, other business types of revenue, the state itself was facing approximately $150 million shortfall. The governor had just mentioned that we did get a little bit of good news yesterday. I tried to refer to it as that, we're still in a very difficult situation. It's just a less difficult situation mildly when it comes to our finances. But the revenue forecast yesterday improved our outlook for in-year collections by approximately $92 million, which has helped us be able to address some of our shortfall for the current year. Other areas of being able to adjust our shortfall, that was forecasted last month has been in maximizing federal stimulus funds that are related to our Medicaid program. In one of the stimulus packages enacted by Congress, those packages included an enhanced federal match rate for our Medicaid program, meaning that the federal government will pay just a little bit more. And we have gone through a process of being able to reduce our expenditures for the last quarter of the fiscal year to be able to help us be able to transition from a deficit to a surplus of just under $40 million at $39 million. And really the other, I think, two good points of this is that we've been able to transition from a shortfall to a positive balance all at the same time while being able to maintain what the governor led and the General Assembly supported, which was the establishment of a budget stabilization account, which I like to refer to as our savings account, which has a balance in it of $126.3 million. And we've been able to do this without having to touch those resources and be able to have those resources available for consideration as we craft a fiscal year 2021 budget. And on top of that, being able to maintain what's called the state's rainy day fund, which is a constitutionally mandated fund that does a number of things for us, but most importantly gives us a little bit of flexibility as we move into fiscal year 2021 in being able to manage our state's finances. So for fiscal year 2021, when I talked a little earlier about the changes in revenue and where we stand today as a state for our current fiscal year, make no mistake that next year is equally as challenging. With the governor's financial plan that was submitted in January and the reductions in revenue that have been occurred since then, what will in essence have to occur is that the financial plan that was submitted to the General Assembly will have to be reduced by approximately $450 million, which is a significant change in terms of what was proposed. So there'll be little to no growth as a result of the economic condition, I think, in the fiscal year 2021 budget. The Joint Finance Committee, as well as the State's Bond Bill Committee, are going to begin meeting the week after next week to be able to begin to work with us through a process to be able to produce a budget, as well as a bond bill, as well as what's called a Grants and Aid Act, which is funding for fire companies and senior centers and a variety of nonprofit organizations, to hopefully have those three appropriation bills completed by June 30th. The next revenue forecast, which is really what we will be used to help settle on what those different appropriation bills will look like, is scheduled for June 17th. So I would say at this point, we have a fairly cautiously optimistic outlook for the current fiscal year, with the understanding that we will need to be able to position ourselves when we do develop a budget with the General Assembly, of being able to develop it in a way that keeps in mind that we may have further changes in revenue as we move through the rest of this calendar year and into next year. So being able to make sure we have a sufficient level of reserves in case we do have decreases in revenue once we set a budget for fiscal year 2021.
Thank you, Mike. The further along you get in the year, the more information you have in terms of estimating your revenues, it's, as you say, relatively good news. In the current year, we're able to go from a pretty significant cash negative situation to one where we're a little bit cash positive. I think one of the things that it does show is that our efforts to be careful in the last couple of years and set aside an extra reserve in addition to the rainy day fund to try to limit operating budget growth really are paying off in a situation like this. Wasn't what we anticipated, but
No.
we have quite a bit of cushion to go through in order to get to the bone there. And I know you've also swept some corners and pulled back some of the appropriations or some of the spending that folks were
I would
willing
say
to
a lot
do.
of corners.
A lot of corners. I know good budget directors, and I know you're one of the best. So we appreciate that, and we'll keep our eye on that June DEFAC, which is a DEFAC where we get additional information on collections, and of course they're very uncertain in this year. So we do need to make some decisions going forward on CARES Act funding. Appreciate that discussion there, and need to have some further discussions with the county executive about revenues that have flowed to the county to cover some of the expenses that we have.
Right, correct. So what the governor is referring to is that through the most recent stimulus package, I believe it was called Phase 3, the state did receive funding in the amount of $1.25 billion in what is called the Coronavirus Relief Fund. And that was a funding that comes to Delaware that is intended to be able to help us as a state be able to cover costs that are related to the pandemic that are beyond our current fiscal year 2020 budget. So it has been a tremendous help for us as a state to be able to meet the demands, but also be able to deal with and address some of our own revenue shortfalls as we have needed to. If you can go back to the next slide, what the governor was referring to is that the funding itself, when it came to Delaware, came with a provision, not just for Delaware, but for states all across the country, that any local government that has a population greater than $500,000 would be able to apply directly for a portion of the state's allocation. And it is based on a formula that is set in the actual federal legislation. And Newcastle County government is the one entity within Delaware, a local entity that has a population that exceeds $500,000 and has such certified and made an application to the federal government, to the U.S. Treasury for its share of funding, of which it has received, and it comes to $322.8 million, which is a significant amount for the county. I believe it's close to over 100% of their combined just general operating budget, as well as their water and their sewer budget. For us as a state, our direct allocation was $927.2 million, which represents approximately 20% of our budget. We received those funds towards the end of April, and the federal government has been able to put some guidance around the state's usage of those funds. I think they have done just a great job of trying to provide flexibility, but at the end of the day, our usage of the funds has to meet three criteria. One is that it has to be a coronavirus disease-related expenditure. It has to not be already accounted for in our current fiscal year 2020 budget, and it has to be incurred between March 1st of this calendar year through December 30th of this calendar year. The one very explicit provision that the U.S. Treasury has provided in terms of guidance is that it cannot be used in any capacity to replace state revenues lost as a result of the pandemic. So as I touched a little earlier on the reductions in revenue that we've experienced since the time the governor has submitted the financial plan to the General Assembly, these resources from the federal government cannot be used in any capacity to be able to help make up any of our own budget challenges as a state. And since the end of April, we've been working very closely, not just with our partners in state government, but also the state's Department of Justice in helping us be able to interpret the rules and the regulations around the funds over what would be considered an eligible expense. The reason why we're doing that is because one of the provisions of the federal law is that if how we use the funds are deemed to be not eligible or not appropriate based on what the guidance from the federal government has been, is that we actually will owe the funds back to the federal government. It'll almost become as a further debt of the state. So we are being cautious, but also mindful that a number of the programs that were already initiated to respond to the pandemic, they are eligible uses. So I'll just touch base on a few of them. First is just the Essential Child Care Center program, which has been in place since April 6th. That's has over 500 child care centers enrolled in it. That is something where is costing us beyond our current state funding that we have set aside to help families purchase child care. And you can see at this point, it's probably costing, or has the potential to cost, upwards of over $20 million a month beyond our budget, depending upon how long the program is in place and depending upon how long we are in the current situation. The other, and I think more notable piece of this is the Unemployment Insurance Trust Fund. I'm sure the Secretary of Labor has been here a number of times, but our expectation based on claims that have gone through the Unemployment Insurance Trust Fund, as well as claims that have been paid out, which are significantly more than what they were when we were at a 3.5% unemployment rate. We're expecting that potentially up to half of the funding that we have received from the federal government could be used to be able to pay for the state share of unemployment insurance benefits. And that has and serves as a tremendous benefit for all of our businesses throughout the state, and that of being able to access and use this funding to be able to help offset costs will positively impact our businesses as we begin to come out of this, in that based upon the way the Unemployment Insurance Trust Fund works is that there won't be any sort of triggers that will result in temporary tax increases to replenish the fund that will occur on all of our small businesses, which is just a tremendous boon for them. And then just a couple other finer points Dr. Rattay had talked about and AJ had talked about: contact tracing and testing. We are going to use these funds to be able to help pay for portions of that. Kent and Sussex County governments, which did not receive direct allocations, and not just those governments, but also the municipalities, we will be beginning a process with them next week to begin to collect their information on what their COVID-related expenditures are, to be able to see if how we're able to provide assistance to all of them, including some of our coastal communities and others, as we begin to reopen the state. And then lastly, a couple of initiatives that were put in place early in April of this year. One is the Hospitality Emergency Loan Program and the Rent and Utility Assistance Application Program, both of which have been running for about 4 to 6 weeks now, where both our Division of Small Business and our State Housing Authority are sifting through a number of applications, and you can see what the range is. And I just can't emphasize enough that just as we are with our revenue collections each month, as we get more information, those the forecasts become a little bit finer. It will be the same with this. As we get more information, as we roll through this over the next several months, of being able to fine-tune expenditures and being able to potentially move towards proactive efforts that are beyond programs that have already been put in place. And just one last point, many of the programs that are here are programs that are part of our budget. These are just costs that are beyond our budget. We do fund child care, we do have business loans, we do have rent utility assistance for Delaware families, the Unemployment Insurance Trust Fund as well. So grateful for the funds. They're absolutely being a help to us as we respond to the pandemic.
So just sticking on this slide, thanks, Mike, for those additional comments and that information. Just if you take just the direct response costs, testing, contact tracing, Kent and Sussex County costs, and the Unemployment Insurance Trust Fund, you can see on the range there that you're over $900 million.
Correct.
And so the idea that we've got a lot of extra money is not an accurate assessment of the situation. And so we do need to engage with Newcastle County with respect to the shared costs there, particularly with those costs, so well in each of the blocks frankly, and we look forward to that conversation. So with that, open it up to questions. I see Meredith here. We got others that have zoomed in, pre-submitted questions afterwards. Thanks for coming again.
Hello. I wanted to get a status update on testing at the poultry plants and how many people ended up testing positive for the virus.
Yeah, so, gosh, I wish I had the exact numbers, and AJ will help me. We'll try to put it together. We're almost finished. I did have a report this morning. We finished first with the Allen Harim plant on Route 5, with the Purdue plant in Milford. We've also done Mount Air plant in Millsboro. There's one plant left, which I believe is the Mount Air plant in Selbyville. So overall, we're north of 5,000 employees, probably closer to 8,000 employees, with, I think, one plant left. Might be another small plant there. We've tested several thousand in community testing sites with various partners. The hospitals have been great. BB, by the way, and Nanticoke have helped us, and Bay Health have helped us in the testing sites for the Purdue plant in Milford, for the Mount Air plants in Millsboro, and next week in Selbyville, and for the Allen Harim plant. There's another Allen Harim plant that's been tested as well. So thousands. It's all the data. I'm not sure all the data is included up to today's numbers, because it comes in at thousands at a time, and some can be processed automatically, most not so much. So just to give you some general idea, when we first started testing the plant several weeks ago, the Purdue plant in Milford, the infection rates were very high, in the 30% range. More recently, the test results that we've been getting out of the plants were in the 10 to 12% and even lower than that in the more recent test results. So there's some discussion about what that means in terms of the spread and whether it's come through and all of that. But the good news is that the infection rates more recently have been below percent positive, which is what we look at. Very high initially, which created the big challenge that went all the way up to the White House with respect to what we could or couldn't do. Dr. Rattay, I don't know if you wanted to add to that, but we don't have the exact numbers, but we're almost done.
Yeah, I don't have much to add to that. It's still more to do, but almost done.
And this is also tied with the long-term care facilities, but what's the state plan for doing more universal testing? I guess what's the impact of just doing one time of universal testing at these different facilities? Is there plans to do this reoccurringly?
Yeah, so that's a really good question. I think one of the areas where, and this is kind of off the poultry plant question, but that we've said that we need to test on a regular basis is at the nursing home employees, right? Because they go out, they circulate, and they're coming and going, and that's where you have a break. I think we're going to do both Sentinel testing, which Dr. Rattay explained and is a better explainer than I. We'll continue to do broad-based community testing and then respond, I think, to hotspots, which originally is how we got there. When we saw the first positive out of the poultry places, we knew we had the potential for a problem, and it didn't take long for that to occur. So we'll be responding accordingly, I think, so the approach we're taking is more intense testing globally, symptomatic and asymptomatic, and then contact tracing, and so figuring out where those people are, much like it was at the very beginning with the little group at the University of Delaware that had traveled out of state, came back with the virus, and we were onesie twosies, tracking down people. That'll be more the approach, and just using data to drive the testing sites and the isolation piece of it.
Yeah, Meredith, I'm not sure if you meant universal testing, the entire population, or employer groups.
I guess in terms of specifically thinking about long-term care facilities with the mandatory June 1st deadline, do you see that happening again a couple weeks from that point, or is that going to be a reoccurring deadline for these facilities?
Yeah, great question. It is recurring. In fact, what is going to be required is weekly testing of staff. And this is consistent with new CMS guidance as well. If you do it more than that, you're going to miss infections. So it really is the best way to protect individuals in these facilities. And we're hearing that this is something that staff would like as well. They would like to know, so that staff will be required to be tested on a weekly basis.
And just UD had some layoffs this week. I'm curious for state employees who see the projections and the budget, are furloughs still on the table or layoffs for state employees?
Well, I said it at the last briefing that our number one objective here will be to prevent any layoffs. Whether we'll be able to do that remains to be seen. But in a situation like this, I think that ought to be the priority, because when you do that, not only is it have negative effects on that particular person and that family, but it has negative effects on the community. And so one of the things that we should be trying to do is keep employees, unless there's another operational need that a reason for those employees not to continue their service. But that ought to be a very high priority. And it was a high priority with the Congress, and it should have been, with respect to the support for unemployment. The extra payment actually was an incentive for people to stay home, because that was, the public health objective, and to get money and cash flow circulating in the community so that the business and others could have economic activity. So that'll be the approach. And I know Mike already, you heard me refer to sweeping out corners, or looking for areas where we can pull back some of the spending now to protect jobs in the future.
From Johnny Braxton at ABC, President Trump said this afternoon, just before this briefing, that he would overrule governors who don't declare churches and communities of worship as essential. What is your reaction?
Well, we never declared churches and places of worship as unessential from the beginning. We had restrictions that would have made it impractical for some not to have in-person services, and many, if not most, decided to do that. We're announcing and have announced new guidelines that would enable churches to go back with limited capacity with those public health protections. The faith leaders that I've talked to, and I've talked to a lot, including the bishop of my own Catholic church, have told me that their first priority ought to be not just the spiritual health of their congregation, but the physical health, and that ought to be a high priority. I did notice that the Catholic diocese is going to move to daily mass, which will make my mother happy, although I'm not going to really encourage her to do that quite yet. And then Sunday services the following week. Other faith communities will do it differently, I'm sure. I have a group that advises me, the Council on Faith-Based Partnerships, which discussed these guidances, and it was difficult, frankly, to get it right for all the different practices. And their number one focus, frankly, was on the health of the congregants as well. So we've always considered places of worship essential. We do think folks ought to do it safely, protect health, their physical health as well as their spiritual health.
From the Delaware Public Media, the first meeting of the school reopening working groups yesterday was swamped by people trying to join and has been rescheduled. Given the level of interest in this topic, what can the state do to ensure public engagement in the process? And would you consider doing town halls by region, similar with the small business and on reopening the economy?
Yeah, so it's kind of a good news, bad news story. You know, you had lots of interest, right, which is what you want, lots of public input, except the technology didn't work. I'm sure they didn't plan for that many people. And so I think that's a good thing, that there's that much interest and input. It doesn't surprise me at all, frankly. I think the direct answer to the question is, yeah, we need to accommodate lots of public input. We've tried to do that throughout. That's why we have these press briefings twice a week, trying to get our messages out, try to be consistent with that messaging, be very transparent in our decision-making, show the data that we're using, discuss the science that drives the recommendations, be specific about restrictions and guidance on each industry and business sector, be clear on what the budget situation is, and educate. There's nothing more important. And I got to tell you, I, for one, am scratching my head about, how do you do it? I did have a call with PTA leaders, I guess earlier this week or at the end of last week, and my advice was let's be yay-sayers. Let's find ways. Let's be creative. The person-to-person, I think, is going to be more of a challenge, but let's do it person-to-person. Let's do it remotely. Let's make sure we're focusing on children that have bigger challenges than other children, not as much support at home, not the kind of equipment that you need to do it remotely. If ever there's a place that can do it, we can do it here in Delaware. We got great leaders, great teachers, small areas. We got some challenges for sure, but I'm confident we can do it. I'm very, at one level, happy that there was so much interest. Obviously, we should have been better prepared for that, and we will be the next time, but we ought to be open to get as much public input as possible.
Christy Fleming at Town Square, Delaware asks, what are you doing to prioritize education and the resumption of through 12 schools in the fall? And are you planning to set aside any federal CARES Act money to coordinate a testing plan for school children?
Yeah, so I just talked about how important the reopening of schools is, thinking through how you would do that. Testing, I think, has to be part of that. Obviously, I don't want to prejudge the work of the committee we've put together. We've got experts doing that. They're going to engage the public just like we talked about. I saw Christie's question that was submitted beforehand, and always thoughtful questions from Christie and thoughtful articles, and she did mention something that was in one of their articles this week with respect to a local vendor, I think, that has technology that could help us do testing in schools and in communities, and I think that could be part of it. But I personally think that's got to be part of the answer. I'm not sure exactly how it works. Certainly, you saw up on the board, Mike had the response to COVID-19. One of the big items there was testing, contact tracing. We know that that's an important part of our public infrastructure. So we've got to take a look at that, and AJ that'll be right on his list.
An article appeared this week in The Atlantic about antibody testing results, and Sean Green at WDEL says that the Department of Public Health is following CDC guidelines in combining antibody and viral testing positives when announcing data to the public. With antibody testing being more of a delayed indicator, why should the public trust the rate data when it comes to positive test results in Delaware?
Great question. I know there's a lot of interest in this topic. So, as I think many people know, there's two types of tests. The PCR testing is diagnostic testing, and the antibody testing tests whether you're having or have had an immune response to the infection. For both of these tests, they are, when you get a positive, it's a positive. I mean, they're both very good tests to detect positive infection. Both of them have weaknesses around negatives. So if you have a negative with either one of these tests, you don't necessarily trust it. And we have ways of trying to explain that. But CDC came out probably 6-8 weeks ago and said, PCR test is a positive case. And an antibody test, specifically if you see an IgM reaction, is, would be considered a probable case. Again, when we see positives with these tests, they are positives. One may occur a little bit earlier in the infection compared to the other, but a positive is a positive.
Melissa Steele at the Cape Gazette says that BB officials say that they were using, that they are seeing a peak of positive COVID-19 cases in August based on a model that they're using. Do you agree with that?
I'll just make a comment about it. I did talk to Dr. Tam about it when I saw this question before, and I would just comment that we've, since the beginning of this, we've seen all kinds of models, and they've been all over the place. Most predicted cases, positive cases, and fatalities that far exceeded what we saw here in Delaware. Part of that is because I'm convinced that Delawareans really came together, followed the restrictions, and flattened the curve. And so we use models. The best model that we have is the data that we have in front of us, the trend over the last 14 days. That's what we've been using to make our decisions. And ultimately, we stopped even following the models from the outside, AJ and Dr. Rattay, and just focused on what was happening with our cases and what was happening in our hospital emergency rooms. And that's the number that's so current and so real, because they count people every day. They know what the condition they are. They're healthcare professionals. As we've explained over and over again, testing data lags. It's not consistent from day to day. It'll get better as we do more and more and more of it. And so as a predictor, and it's a lagging indicator as well. Those hospital datas are real, and that's what we've focused on. I don't know what Dr. Tam's, I don't know what BB's model says about our hospitalizations, but my guess is it doesn't predict what's happening.
Yeah, I'll just add, I mean, as the governor said, there's variability in what we're seeing in these models and what these models are predicting. But what has come to be true is that human behavior is a big factor in what's influencing these models over time. So, really just, adding on to what the governor just said, is much of it is really based on how we behave over the upcoming months. Do we distance from each other? Do we wear face coverings? If we're asked to isolate, do we isolate? If we're asked as a contact to quarantine, do we quarantine? So a lot of it really is up to us.
Two final questions. The first from Cassie Simeon at WBOC. With the holiday weekend upon us, you've said previously that the Delaware State Police will be looking for out-of-state drivers with out-of-state tags heading into Delaware. Some people say this is unenforceable, how DSP will be able to enforce the quarantine restrictions. Any insight into this?
No, that's just my understanding of what the directive has been to Delaware State Police. It's not something that I direct from the executive office. The Attorney General and the Superintendent of Delaware State Police and the Secretary of Public Safety make decisions about enforcement guidelines and the rest. What I know is that our focus is always, and our hope is always, for voluntary compliance. And we've had incredible voluntary compliance over the last 11 weeks. And I can't tell you how many people I hear from who tell me that they're doing their part. And I see people as I circulate in the community wearing masks and keeping separate, and I know that they're doing the part. Our focus at the beaches, this is a critical weekend for us. It'll be a test as to how we're able to keep socially distant, to be safe, to protect our neighbor, how well we're thinking about the effect of our actions on others, because we do rely on voluntary compliance. So our focus is going to be in education, the signage, the beach ambassadors, even the state police first approach is an educational one. And hopefully we'll get through the weekend and have big smiles on our face and know that the sacrifices people have made over the last 11 weeks have been meaningful, and they intend stay the course and help us get through this. And that's what I'm hoping for. And that's the approach that we're going to take on the enforcement side.
Final question for today is from Tom Lehman at WBOC. There's been some headlines of late focusing on short-term rentals. What's the timeline for reopening short-term rental options?
Yeah, that's a big question. Right now, it's a mechanism that we've been using really to kind of moderate gatherings in the beach communities and try to keep the crowds down. It'll be a decision we'll have to make after the weekend and see how things go. I know people are being really hurt by it economically, and it's a real balance act that we need to make there, and we'll do that with an eye towards caution and finding ways that we can accomplish the objectives of public health in a way that it allows for economic activity. I would just like to close off. I got a note this week, and I mentioned at the top about this being Memorial Day weekend and our obligation to honor our veterans, and in particular those who made the ultimate sacrifice. There's a saying in the veterans community that all gave some, but some gave all. And it's a weekend I would ask every Delawarean to think about those who gave all and those who gave some, and that our calling for as Delawareans is to give some, and I know everyone has over the last 11 weeks to get us to the place where we are. And we're here because people have made sacrifices. They didn't put their life on the line necessarily, but I've heard business owners who've anguished over the loss of revenue and seeing their family business or whatever really on the brink. And I know workers who were afraid to go to work because of the fear of getting the virus. And I've just seen people kind of really lean into making the sacrifices for all of us. And my Memorial Weekend message for everyone is not to be complacent. This is an important weekend for us. It's a weekend to honor those who made it possible for us to have the freedoms that we enjoy, and to be in a place where we need to respond ourselves accordingly to the challenge of this time, which for sure is a healthcare pandemic situation like we've never experienced, certainly in our lifetime, and not in generations. And so first I want to thank all Delawareans for what they've done over the last 11, 12 weeks and encourage them to keep it up. Let's not give in now. Let's continue to think about this, that we're all in this together. It's not every man, every woman for him or herself. It's us as a community, as Delawareans, as neighbors. We know that what we do affects our neighbors, and what our neighbors do affects us. And so let's pull together over this weekend, show that we can do it as we reopen the economy, and then we'll get into next week and be able to make some more positive decisions going forward. So thank again our veterans, the family of those who've made the ultimate sacrifice, and take a moment and say a prayer for all of them and for those who passed during this pandemic over the last 11 weeks, and enjoy the weekend at some point as well. Thank you very much.